Good morning, everyone. I am back with a new guest, and today we have Dr. Chris Knobbe. He's a clinical associate professor at University of Texas Southwestern Medical Center, and he actually is a doctor of ophthalmology. So he's an eye physician and eye surgeon. So welcome, Doc. I'm so happy that you're able to make it.
Thank you, Dr. Eric. It's great to be here. Thanks for the opportunity.
Well, the reason I'm bringing you on is number one, I wanted you to speak at our upcoming summit for sure, but your data is fascinating. You cover a point that is just rarely talked about, but it's probably one of the most important things out there that I think people need to emphasize and understand. And I know you're going to get into it, and so I have a bunch of questions for you. So I just want to dive right in. You're a doctor of the eye. So you basically see things from a certain viewpoint, and I want to know a little bit about how you got interested in the diet connection and how that related, because you really talk about the vegetable oils and the impact of vegetable oils on your eye. But how did you stumble on this?
Well, yeah, first of all, I definitely stumbled into it. And to be honest with you and the audience, is that I wouldn't be here today if it weren't for my own suffering with arthritis. That's how it all started, Eric. Was I'd suffered with arthritis for 16 years. And just in a nutshell, I kind of went partial paleo. And in about 10 days, my arthritis improved about 80%. That was back in 2011.
Wow.
And Eric, it was so phenomenally life altering to me after all the suffering I had had, and after seeing so many of my physician colleagues to try to help me. And a dietary change, which nobody had suggested, made that kind of change for me. It just instilled a desire in me to want to know more. And then the more I started digging into this, the more interested I became, and that just kind of ballooned. And really, I guess if you want the rest of the backstory, it's that was 2011, and in 2013 I came across the research of Weston A. Price. And is your audience quite familiar with Price's work?
Most of them are,
Okay.
absolutely. So yeah, I think so.
Okay, so just very briefly, Weston Price uh, uh, did phenomenal research in the 1930s, where he evaluated people all over the world on 5 continents as they transitioned from native traditional diets over to westernized diets. And westernized diets essentially contained refined white flours, added sugars, vegetable oils, trans fats, canned goods, sweets, confectionery, in essence, processed foods.
Mhm.
And Price noted how those foods drove westernized disease that started with dental decay and then was followed by arthritis and cancers and all kinds of degenerative disease. And so that was 2013 for me, Eric. And later that year, as I continued to study, it just suddenly hit me in late 2013 that after I had understood that westernized processed foods are driving heart disease, cancer, strokes, hypertension, type 2 diabetes, metabolic syndrome, obesity, autoimmune diseases, when I understood all that, finally it hit me. And I thought, could processed foods be driving age-related macular degeneration, AMD, which is the leading cause of irreversible vision loss and blindness in people over the age of 65 worldwide? And this is something that, I had dealt with in the clinic for 24 years at that point. And in any case, so then I followed down that path, and I continued to investigate that while I was in practice for about the next year and a half. And in early 2015, I felt I had enough evidence, and I was convinced that I was on the right path. although I knew I needed a ton of study and some more, fundamental research, and I left practice to pursue that.
So a question about where did you personally have arthritis? Was it all over your body? Was it in your back? Where was it?
Yeah, so when I was about 34 years old, it started mostly in my knees,
Mm.
and I had a lot of trouble with my knees in my mid to late 30s, and then I think next it kind of hit my elbows, and then my shoulders, and then my neck, and then eventually my fingers, my toes. Pretty soon I was riddled with arthritis, and I was 50 years old in 2011. And Eric, I was in severe pain, and I'd always been athletic, and I'd gotten to where it was so hard for me to even just jog or warm up to lift weights.
Wow.
It was just, I just, was on a disastrous path.
Wow.
And I
So
was,
it sounds like
and
we go ahead.
well, I was given an immunosuppressant, which I took for
Mm.
one day. And the next day, I heard about the paleo diet and started, like I said, kind of a makeshift paleo, because I wasn't convinced. I was very skeptical. Everything I'd done for 16 years with my arthritis was a fail. But
Wow.
that was all drugs. Like I said,
Wow.
I've probably seen a dozen of my physician colleagues, and I don't want to make this all about my arthritis, but nevertheless, I mean, none of
Mhm.
them had ever said one thing about diet. It was always a drug, an injection, steroids, all that. And
Fascinating. I
none
think
of
we
it
have
worked.
I think we have something in common because when I was 28, I had the similar thing. I started noticing arthritis in my hands, all down my back, my spine. I told my wife, I'm like, what the heck is going on?
Yeah.
I'm in my 20s and I got arthritis. And so I had it a little bit earlier than you, but I know exactly what you're talking about. I'm going everywhere trying to help. At that time, I lived in San Diego, um, and I actually stumbled. Price and Pottinger had a whole center there, and that's where I got introduced to them as well, which
Mhm.
is interesting. So I started turning things around. But getting back to the macula, okay, what is the macula of the eye?
So the macula is the central retina. It
Okay.
accounts for about the central 10 degrees of vision. And it is responsible for you being able to see somebody's face, to read words on a page, to see a stop sign. It's it is your central vision. And if that part of the retina degenerates, then your vision will begin to decline. And macular degeneration is probably, for ophthalmologists today, it's probably second only to cataracts in terms of what uh, ophthalmologists deal with, and optometrists too, in westernized countries.
Interesting.
And so, yeah, so this disease, it gradually steals your vision typically, and then it can progress to a wet stage, which can be severe. And let me just tell you that this year, they estimate that 196 million people are affected with macular degeneration in the world. And of those, by some estimates, the World Health Organization's data would suggest that as of 2006, and that's the latest data I have for blindness, but bilateral blindness, probably around 3.15 million people in the world bilaterally blind, meaning both
Both
eyes
eyes, yeah.
centrally blind. They can't see they can't see their spouse's face, their grandchildren's face. They can't see to drive or read. And if you think about that, that is a staggering number of people. It may be more than that. So it could be approaching the population of the state of Colorado, where I live today, in the world, all blind, from this disease. And when I first investigated this, Eric, I had to go back and look at all the history. And this, I couldn't find any research that had done this. And what I found was that, in a nutshell, that between 1851, when the retina was first visible, because of the invention of the ophthalmoscope, And then over the next 80 years, up until about 1930, there was no more than about 50 cases of macular degeneration in all the world's literature. And
Oh my gosh.
ophthalmologists were using the ophthalmoscope and recording images and diagrams in the 1850s. And so I go through that data. But in a nutshell, what I found was that this disease was extraordinarily rare. And it changed as our diet changed. And the big picture here, everybody, if you don't already know this, is that we didn't have any man-made processed foods in the world, with the exception of sugar, up until 1866 approximately. So we had very small quantities of sugar. Processed foods, again, being sugar, refined flours, vegetable oils, and trans fats. And right after the American Civil War, 1866 is when we first got vegetable oils. We got refined white wheat flour in 1880 because of roller mill technology, which is another refined nutrient deficient food. And then in 1911, we got trans fats. And if you put those four foods together, that makes up processed food. It's so incredibly simple, but those four things now, big food manufacturers make 500 some thousand foods out of those today. And those, first of all, are severely nutrient deficient, and then they are toxic. And here's what I will submit to you is that almost all of these chronic diseases are driven by nutrient deficiency and toxicity, and they all come from these foods. The foods are nutrient deficient, those four processed foods, and then they have toxicity related primarily to vegetable oils, trans fats, and probably the fructose component of sugar if the dose is right.
Well, I if you take a look at each one of those individually, I looked at the consumption, I think before 1970. I just looked at 1970 to now, and we have a trend going up with refined grains. We have a trend in going up with sugar. But what I didn't understand until I looked at your stuff is that there's a massive spike. I think it's 4x with vegetable oils. I mean, that's the thing that really took off. And we're all emphasizing avoid sugar. Well, yeah, we know that, but there's not enough emphasis about avoiding the vegetable fats and understanding what they can do, not just to your eye, but the whole body. They can cause insulin resistance, just like sugar. And I guess these the way that they're processed is just completely and utterly barbaric. I mean, it's like they're heating it, and then there's nothing left. I mean, and they're very inflammatory. So when you look at the macula and you're trying to evaluate what's going on with someone's vision, and let's say it's just starting to become a problem, would they notice like, oh, I'm not seeing that well, and that could be maybe the eyeball's not shaped correctly, maybe the lens is not correct, or it could be the macula. Is the symptom of lack of eyesight very similar to all four of those causes, or is it a different thing where the central part of your eye you can't see because the macula handles, so there's blurry in like a little circle when you look? Or how would you differentiate macula versus just the shape of the eyeball is not right as far as vision goes?
Yeah, good question. So first of all, you may not have any symptoms in the early stages of macular degeneration. In fact, you probably won't recognize anything. And the symptoms of any decrease in vision, you would never be able to distinguish on your own from cataract or from refractive error, being nearsighted or astigmatic or farsighted or whatever, or maybe even glaucoma. You're not going to be able to distinguish anything yourself, and you should never rely on your own perception of your vision. You need to see an ophthalmologist or an optometrist to be evaluated and have your retina evaluated. Everybody should start doing this in their 40s for sure. And every 2 to 3 years, I won't get into all the detail, but people need to have their eyes examined, Eric, in order to evaluate for that.
But the symptoms are similar.
Oh, the majority of people that in the early stages of macular degeneration, they're not going to have any clue at all that they have this disease. And of course, this would be the best time. I mean, of course, you want to try to prevent all of these diseases. And the best way to do that, the only way to do that is through diet. And, you know, but if you have it already, the best thing to do is, you know, is see an ophthalmologist or optometrist, have a diagnosis, and then you would make the same exact changes to your diet in order to prevent progression of the disease that you would in order to prevent it. It's the same exact thing.
So when you look at the macula and you're diagnosing, what are you seeing? Is it extra blood vessels, or is there, can you see like this destruction? Is there plaquing? Like what's happening in the macula that's causing this? What does this degeneration look like?
Well, you know, the best thing would be to have an image of that, but you know, because none of our audience is really going to hardly know what the retina looks like, but you see these little, you know, whitish yellow dots called drusen, and you see something called pigmentary disturbance, which is something that is affecting the retinal pigment epithelium beneath the, you know, beneath the retina proper. And that's the first stage, and that's the dry macular degeneration. And if it progresses, Eric, which about 15%, 10 to 15% of the people that have dry macular degeneration will progress into the wet stage. And this is a stage where the vessels can grow up underneath the retina, leak fluid and bleed. And that is devastating to the vision. And the account can be treated, but I don't know that we should get into that at all. But
yeah, I was just kind of curious about the effects of like just vegetable oils as an oxidative, inflammatory, free radical thing that's creating that damage, or is it similar to diabetes where you're creating destruction of the blood vessels to the eye through the retina itself? I don't know, but I'm just curious from my own viewpoint.
Yeah, you know, Eric, I almost have to giggle when people ask me, you know, during like a podcast or whatever, you know, tell me what the cause of this is at the molecular level, or tell me what is the mechanism?
Right.
You know, I was thinking the other day, I should say, okay, let me summarize 32,500 scientific papers that have been published on this in the last 4 decades, because that's basically about what there is. I mean, there's an extraordinary amount, you know, of evidence here to try to, you know, put into a nutshell. But let me just say that here's what I would submit as a big picture is that vegetable oils they have 4 main problems, and this is going to apply to macular degeneration, heart disease, atherosclerosis, stroke, type 2 diabetes, metabolic syndrome, obesity, Alzheimer's, Parkinson's, autoimmune. Okay, the main thing is that vegetable oils are first going to be nutrient deficient because they don't have any vitamins A, D, and K2. None in any oil, even the really good oils like a good coconut oil. None of those vitamins, right?
Yeah.
So this puts you at risk for nutrient deficiencies, and vitamins A, D, and K2 create an amazing synchrony and synergy that drives health. And so this is what, you know, Weston Price began to show us back in the 1930s. I mean, did an incredible job with this. All right, so that's the first thing. So when you supplant and replace the healthy animal fats, lard, butter, beef tallow, you know, eggs, organ meats, fish eggs, all these kinds of things that are rich in these fat-soluble vitamins A, D, and K2, when you supplant those with vegetable oils, now you're nutrient deficient. That's problem number 1. Problem number 2, you're going down a pro-oxidative pathway. And Eric, I cannot tell you how important I've learned, so much I've learned over the past few years that tells me this is the most important thing of all on a mechanistic level is the pro-oxidative effect. Okay, so that drives oxidation. I can come back and review that in some detail. Third, pro-inflammatory. So the omega-6 seed oils are pro-inflammatory, going to lead you down an inflammatory path. And then finally, they're toxic. And I don't use this term toxic loosely. What I mean is they are poisonous. And they're poisonous because the seed oils they contain and or in our own bodies will produce toxic aldehydes for one thing, but these toxic aldehydic end products, which are things like 4-hydroxynonenal, which is 4-H&E, malondialdehyde or MDA, 9 and 13-HODE, which is hydroxyoctadecadienoic acid, carboxyethylpyrrole, and acrolein. These are just 5, but there's hundreds of these toxic aldehydes that are connected with all of these diseases. So collectively, those things right there are cytotoxic, meaning directly toxic to cells, genotoxic, toxic to the genes, mutagenic, carcinogenic, atherogenic, atherosclerosis inducing, thrombogenic, clot inducing, and obesogenic. And on top of all that, we have, if you look at the whole picture, the seed oils are driving, if you look at the just big picture, one of the first things they do is they damage the mitochondria. And the first thing that happens at the mitochondrial level is you become insulin resistant at the cellular level. And this is where I'm seeing insulin resistance and mitochondrial dysfunction. And the mitochondria are the powerhouses of the cell. For those who don't know, that's where 90% of our energy is produced. And seed oils severely damage the mitochondria through these oxidative effects, and you begin to lose energy, and the cell begins to become dysfunctional and or dies. And now what I understand, and what people understand, is that work on this all the time, is that mitochondrial dysfunction is a part of all of these chronic diseases. It's heart disease, congestive heart failure, atherosclerosis, cancers, macular degeneration, type 2 diabetes, metabolic syndrome, if I didn't say it yet, obesity. All these disorders are connected through mitochondrial dysfunction. Why would they all have this? And the reason I'll do is oxidative stress. And where does oxidative stress come from? Primarily seed oils. Now,
what about someone sitting back watching this and says, well, I don't use corn oil, I don't use vegetable oil, I don't use Crisco, so I'm good. They don't have the awareness of how insidious this problem is. I mean, it's in, I don't know how many foods. I think I read on your website, there is an average person consumes 700 calories of this stuff per day in their diet without even knowing it. Is that, am I exaggerating or?
No, that's exactly right. Let's see. So it was 80 grams a day of the average person in 2010.
That's
we did this research, and I can go back and give you the big picture. But in 2010, the average American was consuming 80 grams of vegetable oil a day. Well, oils, fats are 9 calories a gram. So that's 720 calories. And that is 32.5% of US consumption. Literally a third of our diet is coming out of factories. I mean, Ivor Cummins calls these factory fats. And Kate Shanahan, who studied this for 25 years, she says, nature doesn't make bad fats, factories do. And I think that's a powerful message, because these oils, they're not natural.
No.
They're heated, they're chemically treated, they're alkalinized, bleached, and deodorized, all chemically, and heated about 4 or 5 times. And by the time they hit this bottle, and you've got this nice, pretty looking, kind of slightly yellow oil, it looks great, but that's a bottle of poison. And because it's extremely oxidized, it contains all these toxic aldehydes, and when you consume it, it will accumulate in your body. But if I go back here, Eric, so if so, I did this analysis. This will be coming out in our next published paper I'm working on with a bunch of other ophthalmologists and vision scientists. But I did an analysis to look at what our omega-6 linoleic acid, that's the main fatty acid in seed oils, what our consumption of that fatty acid would have been in 1865 before the world had any of these vegetable oils, and it was 2.2 grams. So we got seed oils by 1866. Well, by 1909, we were already at 4.84 grams. By 1999, we were at 18 grams a day. And by 2008, we were at 29 grams a day. Okay, now let me give you the percentages. So in 1865, before the world had any vegetable oils, in the US, for example, that 2.2 grams of omega-6 linoleic acid, that is about 1% of our caloric consumption. By 1909, we're at 2% of caloric consumption. By 1999, we're at, sorry here, I try to remember the numbers. I went blank. It's, 7%. There we go. I have there 7% of caloric consumption. And by 2008, 11.8%, just round it off, 12% of caloric consumption. Okay, now.
It's like a spike.
Yeah, so people will say, well, we need, linoleic acid, you need omega-6 and omega-3. And you do, they're essential fats. You have to have linoleic acid and alpha-linolenic acid, which is the comparable omega-3. But guess how much? You need 0.5% of your diet needs to be omega-6 linoleic acid. 0.5%. That's the essential.
Half of a 1%.
Yeah,
wow.
and so in other words, so we went from, let me just put it to, in 2008, we're consuming 24-fold more omega-6 linoleic acid than what we actually need to be consuming. If you look at all these, native traditional populations, which I've done, and I'll go through when we do the Keto Summit, I'll hit some of those, but I've looked at all these, and all of them, they're omegas. Okay, none of them have any vegetable oils, because if you had vegetable oils, you're already consuming a processed food diet. You're already westernized. But all these native traditional populations who don't have sugars, white flours, seed oils, or trans fats, all of their the highest omega-6 I have found is still under 2%. The Maasai of Kenya and Tanzania, they consume 66% animal fat, which is at 33 to 45% saturated fat, but their omega-6, with all that fat, 66% of their diet being animal fat, their omega-6 was still 1.7%. Well, the omega-6 in, westernized diets all around the world today is around 8 to 12% or higher. And what's happening? The whole world is getting overweight, obese, and sicker than dogs. And this problem is, I was thinking that the problem is far worse in developed nations, but guess what? The World Health Organization shows us that developing nations, 69% of the deaths in developing nations in recent years are from chronic disease. These same things: heart disease, cancers, strokes, hypertension, type 2 diabetes, all that. And guess what? So let me give you one more statistic. Between 1963 and 2003, in developed nations, vegetable oils doubled. On average, Kaiser did this work. So 40-year period, they doubled in developed nations. But in developing nations, vegetable oils tripled in that same period of time, in that 40-year period. And in developing nations, their sugar consumption is really low. the World Health Organization says don't consume more than 10% of your calories as sugar. I think that's very good. But you know what they were in developing nations during that period, from 1964 to 1994, I believe it was. Their consumption of sugar in developing nations on average was around 6 to 7% sugar. It's not sugar driving
Right.
it. I mean, why are all
Wow.
these people in developing nations, why are they all getting these diseases at as much or higher rate than we are?
Right.
Because of vegetable oils. Vegetable oils have gone everywhere that, just like Weston Price showed in the 30s, if you could get to a place by roads, by a port or roads, processed foods were there. The big food manufacturers were selling their food, and there's just a few isolated places in the world where people aren't consuming these foods.
What is the, I don't know if it's the USDA or whatever, but aren't they recommending that we consume more vegetable oils than saturated fat? So that's been the push, right?
I don't know about the USDA, Eric, but I can tell you this. Sally Fallon from the Weston A. Price Foundation calls these organizations the diet dictocrats. And she's talking about the Harvard School of Public Health. And I'm not, this is not about Harvard. It's about the Harvard School of Public Health. And then the nutrition department of Tufts University, also in Boston, the nutrition department of Mayo Clinic, the American Heart Association, and there's a bunch of others. They're all collectively telling us vegetable oils are healthy, omega-6 is healthy. And so people are so confused because, if Harvard tells you it's healthy, who are you to believe?
Right.
And this is one of the reasons I think people like you and me and Chris Masterjohn and Chris Kresser and Joe Mercola, get into this is because, most of us from our own suffering, and you start going, I got to figure this out because I can't trust the diet dictocrats to tell me what's right. Why do they tell us this? Eric, there's only one reason they tell us vegetable oils are healthy. One reason, as far as I know, and it's because vegetable oils make your cholesterol go down. So if you believe that cholesterol is the problem in heart disease, you might buy this argument. And that is such a massive fallacy, as you know, that it's not about cholesterol. It's about, it's not about LDL. It's about oxidized LDL when we talk about heart and all that. Where does oxidized LDL come from? It comes from the exact same thing. Vegetable oils and sugar, possibly, to a lesser degree, but vegetable oils are driving oxidized LDL, and oxidized LDL drives atherosclerosis, drives coronary heart disease. And, Ivor Cummins has showed us that, he's brought our attention to the fact these studies have shown, for example, that the greater your oxidized LDL, the greater your heart disease on a coronary artery calcium scan, which is the gold standard for evaluating heart disease. I just had mine done this year and found a 0 score.
Nice. I had mine and it was 0 too. Probably would have been a lot higher before. And I know you'll get more into this in the summit, but these vegetable oils also have a half-life of, I think, 1 to 2 years, and they make up your cell membranes. They go into the body, and they, if your body's made of these oils, it's a lot different structurally, and it's going to affect you on a whole different level. Probably stiffening of the arteries. Who knows what else? It's just crazy.
Yeah. So if you eat sugar today, if I eat a cup of sugar today, I can either store it as glycogen in my liver and muscles, or if I've consumed enough calories, I'm going to convert it mostly into monounsaturated and saturated fat, right? That's what it's going to be stored as. But if you consume polyunsaturated fats, your body, these omega-6 oils we're talking about, and omega-3 too, your body was designed to get these in really tiny quantities because we weren't designed to ever have vegetable oils in our diets. And so your body stores these omega-6 and omega-3s preferentially. And it doesn't want to burn them, beta oxidize them for fuel. That doesn't work well. We can talk about that. But anyway, so yes, you store them, and they get stored in your fat, and they get stored in your cellular membranes, and they get stored in your mitochondrial membranes, where they create all this havoc. And the thing is they store at approximately as an approximate level, whatever you're consuming in your diet, your adipose tissue will be approximately twice as high in this omega-6. So if you consume 1% of your diet as omega-6, you'll probably be no more than 3 to 4%. I said roughly, okay, with your in your omega-6 in your fat. But if you consume 10 or 12% of your diet as omega-6, you will be at about 20-some% in your fat. So Stefan Guyenet showed this data, just brilliant stuff. He looked at 37 studies that looked at the linoleic acid in our body fat, in Americans' body fat, just Americans, 37 studies, and collated all this data, graphed it. So 1959, the average linoleic acid, omega-6, in Americans' fat was 9.1%. 9.1%. Now remember, obesity in 1960 was 13% in the US. 2008, linoleic acid in Americans' fat averaged 21.5%. What was obesity in 2008? I think it was around 32%, something like that. And all of these diseases have tracked accordingly. So this is what we see, is the more of these you consume, the more they're stored in your fat, and they stay there. Okay, oh, and back to your question, how long are they in your fat? Well, this is the really bad news. This is where you have to pay for your nutritional sins. And I hate this, but the half-life shown in studies, and there's been multiple studies that have looked at this, but the half-life of these omega-6 fats in your fat is 600 to 680 days. You might as well round it off to around 2 years. Wow. Now, in pharmacology, what we learn is it takes about 5 half-lives to get rid of a substance like a drug from your body. Now, nobody knows if that applies exactly to linoleic acid, but as a rough estimate, then that means that it's gonna take a few years, maybe up to even 8 or 10 years, once you get all these out of your diet, you get your omega-6 really low, to get your omega-6 in your fat down to a really low level like it should be. But you know what? In 3 days of getting vegetable oils out of your diet, your inflammation markers will go down, your pro-oxidative status will go down, your toxicity from the aldehydes will go down. Guess what? You'll have far less risk, I believe, of heart attack and stroke in 3 days.
Wow. This, if you're watching and you're wondering what oils we're talking about soy, corn, canola, cottonseed, probably some other ones as well, like safflower, sunflower, maybe even peanut oil. I don't know. Peanut oil?
Yes. All of those.
Yeah.
So I'll say them too. It's soybean, corn, canola, cottonseed, rapeseed, grapeseed, sunflower, safflower, and rice bran. Those are the biggies. There's a few others, but those are the big ones. So if you just want to we've got to get the big picture right first, and that's just get those out of your diet.
Yeah, start reading labels too. It's in the salad dressing. It's in mayonnaise. You can't find a salad dressing without it. I mean, it's difficult. So
it's almost impossible. And I wouldn't, even a salad. This is where Sally Fallon says, "Where's the best place to start?" She says it's with your salad dressing, because they're all made with these vegetable oils. And you and your audience probably both know this, Eric, but you can't trust olive oil in the United States. 79% of it is adulterated with these vegetable oils. And why is that? It's because even olive oil, and we can talk about olive oil, I'm not the biggest fan, partly for this reason, but it's being adulterated so greatly that 80% essentially of the olive oils in the US you can't trust because they're adulterated with all these cheap, just, horrible oils. And why is that? Because it's very profitable. Olive oil, good extra virgin olive oil that's properly prepared and maintained and all that, is expensive. The seed oils are dirt cheap. In 2000, as recently as 2014, on the world's market, 1 kilogram of these vegetable oils on average was $1.
Oh,
Well,
come
80
on.
grams a day of that, in the American diet works out to be about 8 cents.
Oh my
I think
God.
it is. And as low as, for soybean oil, as low as 5.6 cents. So in other words, so here's the thing is, you can take, let's say you want to make Pop-Tarts as a big food manufacturer. You can take, 5.6 cents or 8 cents worth of these oils. You can take 2 cents worth of refined wheat flour and 2 cents worth of sugar, and you can make Pop-Tarts and sell them for $4. And so
Wow.
most of the money goes into the marketing, not into the product.
Right, the
And
box.
so getting back to your, question and statement about these are in all the foods. Well, guess what? Almost all the processed foods you look at, they're made primarily of these four things. You just put them together. Just look at every label and you find out most of them are going to be made from refined flours, sugars, and seed oils. If it's got any of those oils, I wouldn't touch it with a 10-foot pole, and be really careful about olive oil. I wouldn't trust most of it. That's a sad fact. I do think that olive oil can be okay. I don't trust it. And I'm a little bit skeptical, quite frankly, about the polyunsaturated fat even in olive oil. For most Americans who already have a lot of omega-6 in their own fat, it's too high. I would get it out. I just cook everything in butter. We just stick with pasture-raised butter to cook everything in. I just don't trust oils, quite frankly. I don't trust any of them for the most part. I think coconut oil is probably the safest one on the market.
Yeah.
But even coconut oil doesn't give you vitamins A, D, and K2,
No.
like butter would. I mean, a good pasture-raised butter is going to give you all of those.
Yeah, exactly. So this brings me to I will have a lot of questions, but I have to withhold myself because we're going to talk, you're going to talk about a lot of this at the summit, but well, let me just quickly just ask two last questions. Okay.
Okay.
When you consume mineral oil, for example, I know for a fact that pulls out of your liver and your body a lot of the fat soluble vitamins because it's an oil and it just kind of depletes you. I know when someone exposes themselves to mineral oil, they end up with a deficiency of vitamin A, vitamin D, etc. So my thought was, when you mentioned refined oils, just like refined sugar, they'll deplete you not just the vitamins but the fat soluble vitamins. So I'm guessing that's probably why, because they're like a vacuum. There's no vitamins in there, and they're just going to suck out some of the which is in your liver, I would imagine. That's one question.
Well, I'm sorry. Well, first of all, I don't know what mineral oil is. I have to.
People take it as a laxative.
Yeah, but what does it come? I mean, does it come from different sources, or what is it coming from, Eric?
Honestly, I think it's it might be some type of petroleum product. I'll have to find out the exact ingredients, but it's a really refined, empty oil that people use as a laxative. And I actually don't even know for sure, but I'll have to find out.
Okay, I guess I've never thought about it. And this is what, every once in a while somebody throws a question at me and I just go, like a guy asked me about emu oil the other day, and I'm like, I don't, but there's some principles there that I could get to, but I'll have to look in, about mineral oil. I don't really know what its source is or what it's made of.
Yeah.
And so,
okay.
So I don't really have an answer for that at all.
Totally
But
fine.
if I don't know the answer, I'll just tell you, I'm trying to learn. I learn from people every day about this, and I don't care who I learn it from. I'm just trying to learn, like, like you and everybody else.
Right, me too. And then the other question is a side question. So you have all these people that have fatty livers, and there's quite a few of them. I mean, if you have a gut, you have a fatty liver, and they're doing the vegetable oils, they have insulin resistance, they're doing sugar. And what happens is that the vegetable oils really can disrupt the production of bile in your liver and the
Mhm.
release of bile. I know that even when I was in practice for 29 years, the damage that these vegetable oils do to your bile ducts in the liver, as far as they become bile deficient, they can't release, and a lot of that bile starts backing up into the liver, and it starts to create fibrosis and scar tissue. So there's really a lot of not just gallstones, but just a congested cholestasis where you have this stagnant bile that's just clogging everything up. But
Mhm.
what's interesting, the treatment for that is bile salts. And what's interesting about that is that there seems to be a really interesting connection between taking that and improving eye vision. There's a vision component to taking bile salts that I've looked at. And the reason I'm bringing it up is because you're an ophthalmologist. I don't know if you've ever looked at that connection, but I noticed when I used to put my patients on bile salts, their vision would just really improve greatly. And either the mechanism is it triggers the vitamin A receptor in the eye, because I know it's an analog, or it just might help you drain all the liver so you can start to have the liver function again. But there's an interesting connection between the vision and your liver and bile. So I don't know if you ever looked at that or had experience with that. I just wanted to bring it up as a side note.
Yeah, no, well, first of all, here again, you've taken me completely off guard.
Sorry about that.
And I don't know that much about the liver disease. I do know, I mean, with regard to bile and bile function and how bile salts, my first reaction is that if we're, uh, um, vegetable oils are reducing our ability to, first of all, absorb vitamin A. And not only that, they're vitamin A deficient, but they're affecting our vitamin A absorption. And I'm thinking that, perhaps the bile salts then are improving vitamin A uh, absorption, perhaps. And well, I'm honestly just guessing here, Eric,
No,
and
that sounds
work through it, with what I do know. I may be off base here, and I don't mind saying, yeah, I mean, I may be off base here, but, some of my recent work, for example, with the eye, and this applies to the whole body, the world is vitamin A deficient. The
mm,
world almost it's just as rampant, if not more so, than I think it's more rampant than vitamin D deficiency. And probably everybody who's looked at this at all realizes that vitamin D deficiency is extraordinary in this
mhm,
world today. And both deficiencies are connected with almost any chronic disease you can name. There are inverse relationships between vitamin D and vitamin A, uh, and virtually every chronic disease there is. In other words, as the chronic disease prevalence goes up, the vitamin A and vitamin D deficient or levels go down. In other words,
mm,
more vitamin deficiency, more disease.
mm.
And then K2 comes in there as well, but K2 is even much harder to, as far as I know, to measure and analyze. But
Mhm.
vitamin D is easy to measure and supposedly treat that, and that's another entire topic.
Mhm.
But anyway, I'm thinking that this could goes back to vitamin A absorption, perhaps.
Yeah, that makes sense. Well, anyway, I just really appreciate your attention and your time to do this. And for everyone that is on, he's going to be on the next summit at the end of August. So I hope you guys can show up, because it's going to be an amazing presentation, and you'll be able to deliver the full rundown on what you've been studying. I'm really excited to see that as well. So thank you, and we'll be seeing you in August, at the end of August. And I'll put the link down below for more information, as well as your website and your information. You have a foundation, as well as a
Right.
lot of great data on macular degeneration, and I'll
Right.
put all that down below as well. Awesome.
Right. Yeah. Just so if I could say it, I work for Cure AMD Foundation. It's at cureamd.org. We are a 501c3 nonprofit. And so nobody in our organization, including me, is compensated for anything we do for this. Our goal is to help people and to prevent vision loss through ancestral diets. And we're fortunate we've now reached, we think, people with macular degeneration, over 1 million people
Wow.
so far, but we want to reach the world. So we'll hope. I want to thank you, Eric, and thank all of your audience for watching, and help spread the news, because this is a grassroots movement. We've all got to do, we're all in this together. The way I
Yeah,
see it, we can't do this without people spreading the news,
that's
because
right.
that's where it's at.
Well, I'm glad I stumbled on you, so that's great. Thank you so much.
Thank you so much, Eric.